Discovering Vascular Dementia by Ariana Cameron. Today I will be talking about what vascular dementia is, some of the signs and symptoms of vascular dementia, and what can cause it. What is vascular dementia? According to the Alzheimer's Association, vascular dementia is when blood supply to the brain is impaired and it results in decline in functional skills and thinking skills. The prevalence and demographics of vascular dementia. There's age to be considered, African American males, and how common it is. For age, vascular dementia in 85 and older patients have more prevalence in having it. It can also be acute and happen at any age, and this can be due to stroke. Elder African American males have a higher percentage in the population for vascular dementia. Vascular dementia is the second most common type of dementia. Risk factors. There's many risk factors for vascular dementia. Some are heart disease, atherosclerosis, high cholesterol, hypertension, stroke, smoking, and alcohol use. These are just some of the risk factors of vascular dementia. The pathophysiology of vascular dementia is progressive worsening of memory and cognitive function, ischemic brain injury, genetic history of heart disease, high cholesterol, and high blood pressure. Signs and symptoms. When a patient is unable to stand, keep balance, inability to stand and walk straight, having coordination issues with grabbing objects, dropping things, and frequent falls, inability to stand up from a sitting position. These are signs and symptoms. Also having memory difficulty with remembering things and memory loss is another sign. Signs and symptoms. Inability to pay close attention to things, focus, unable to pay attention, restlessness, in motion all the time, not able to relax, feeling agitated. These are signs and symptoms of vascular dementia. Unable to make decisions, and the inability to make choices on their own is also a sign and symptom of vascular dementia. Assessment tools. The most commonly used exam for assessing a patient with dementia and vascular dementia is the mini mental status exam. I frequently use this, and because it assesses the patient's cognitive function, orientation, and level memory. The AMTS stands for Abbreviated Mental Test Score, which focuses on concentration and memory. Here in the picture, the frontal lobe, it explains that thinking, planning, organizing, and problem solving. This is a common problem for patients with vascular dementia. They are unable to plan, stay and remain, or be organized, and having difficulty with problem solving. Assessment. I like to assess the labs of these patients, look at their cholesterol levels, look at the vital signs and their blood pressure readings, assess their blood glucose level, because a lot of times they come in, it can be either too low or too high. Looking at their coordination and balance, and getting a very thorough medical history is of most importance. Getting the medical history from the patient or their family, finding out if they've had any recent or past strokes is important. Good catch. After completing this assignment and learning about vascular dementia, I saved a life. My patient had an emergency bedside traumatic procedure. He had 3 large kidney stones. One stone broke up into several pieces, and his wife took him to the ER. He was immediately admitted. Upon this admission, the urologist that was there at the time, decided to do an emergency procedure at the bedside. My patient had not had any anesthesia or any anesthetic at all. A lithroscopy was done at the bedside with the patient sitting up on the edge of the bed. My patient was in severe, excruciating pain. He had a lot of blood loss and had several units of transfused blood. Later that week, my patient was discharged home, and I called to check on him as his care coach and RN to see how he was doing to follow up. At the beginning of our conversation, I immediately knew that he was not himself. He didn't even sound himself on the phone. He was confused, and he was having incontinence of both bowel and bladder. I discovered that he may have had a mild stroke during this traumatic procedure. I contacted his primary care and was able to get him an appointment that day. Later, we discovered that he did, through a CAT scan and MRI, have a mild stroke. He was treated, and 4 weeks later, he's back on the path to recovery, and he's doing much better. I want to thank you for taking the time to review my presentation and learn. I hope you learned a lot about vascular dementia, and thank you for your time.